This is the Chapter 11 lecture on healthcare costs and value. As we've worked through this course, many of you have been concerned about the high cost of healthcare and the low quality, and this is exactly what you are describing. We are going to dig through this chapter. It's very dense, but it has wonderful information for future healthcare managers. We begin by talking about the large amount of money that we spend on healthcare. It's about a fifth of all economic activity, and what is especially concerning is that this high level of spending does not equate with better outcomes. The textbook also does a nice job of looking at the reasons for this high spending. You can see here some numbers to really drive the points home. Per capita or per person spending has increased dramatically, and these dollars have been inflation adjusted. So this is comparing apples to apples. A 775% increase over this time period. And you can see the growth reflected in the healthcare spending as its annual growth, which has increased more than the GDP, which is always worrisome. A few graphs that are great to look at. This shows national health expenditure as a share of gross domestic product. So of all goods and services, our spending on healthcare has just gone up, up, up. This compares to other countries, and you will see that other similar countries in terms of economics have an increase, but our trajectory is much steeper. So why is this such a concern? The increased cost has a lot of impact, and you see here it's a tax strain on both workers and employers, and this allows fewer tax funds for other needs. So when healthcare costs goes up, there's less for infrastructure and for schools, etc. Insurance costs rise, and employers give out fewer salary increases, or they're dropping or limiting health coverage or decreasing full-time employment. So it has wide-ranging ramifications. Some other charts that are very interested. Here you see over the years how employee premium contribution has increased, deductibles, and combined premium and deductibles. And families are feeling this for sure. And finally, when you're looking at costs, it's important to understand who is using most of the healthcare. And that's what you're looking at here. 5% of the total population uses 50%, okay? 50% of the expenditures. 10%, 66%. So sometimes working with focusing on those high users can help us drop the healthcare expenditure curve. Value is difficult to define for healthcare. Value is much easier for something like a car or a jacket. You're getting a high quality product for a low cost. But it's a little more difficult in healthcare because we need to understand what the patient desires from the healthcare system. Read through this for sure. And here is a description of cost drivers and barriers to value. This is very well done. Many of you have spoken on concerns about cost, and now we see some of the key drivers. So we have the fee-for-service payment models. We have failure in care delivery, failure of care coordination, over-treatment, spending money on things that don't work, or not spending money on things that do work. Our administrative system with healthcare is complex, includes some fraud, but certainly drives up costs for sure. And there are pricing failures in the system. Wide-ranging prices for exactly the same test or service. So your textbook also looks at the initiatives to address expenditure and how these perhaps have value trade-offs. Shifting costs to employees, so higher premiums, higher co-pays is something that's very, very common. There are many problems with that. That's more of a burden on the employee, but that also causes employees to self-ration care. The creation of managed care organizations, new payment models, and value-based payment models as well. The textbook spends a lot of time looking at the whole concept of bundled payments. Value-based payment models are models in which a lump sum is given for a particular incidence, a particular health problem, and that incentivizes the physician to be smart in their use of that bundle, in their use of that money. Because if they're able to keep the patient healthy and yet not overprescribe, overuse healthcare, they can save money. That's a very simple description. The delivery system, of course, has to be reformed. It is inefficient, it is uncoordinated, it is wasteful. And we revisit some of the ways of changing the system. The patient-centered medical home is one that's been looked at a whole lot and great. Patient-centered, it's comprehensive, it's coordinated, it's accessible, it's committed to quality and safety. Our health centers in Philadelphia are moving toward the patient-centered medical home model. More on the delivery system reform includes accountable care organizations, read about those, oncology care model, and other novel programs for delivery reform. Again, the purpose here is not only to decrease spending, but also to increase quality. And that's very, very important. We don't want a system that just saves money and drops quality. We have quality issues already. So we want value, less money, better quality. And you'll read about some state-driven value-based initiatives as well. This should really get you thinking about managing healthcare and adapting and changing in the area of cost.